Good morning, Chris. How are you? It's been a crazy night, and so let's go ahead and get started. Our first patient is Mr. Robert Anderson. He's 76 years old. He has no known allergies, drug allergies. So yesterday he fell at home and fractured his right hip. He was brought to the emergency department and then to the OR for an open reduction internal fixation. In surgery, he ended up having 1 unit of cell saver blood, 1 unit of autologous blood, and he has 2 units in the lab if you happen to need them. He has a wound drain in this dressing. The dressing is clean and dry. I emptied that wound drain for about 40 cc's, around 430. Let's see. I think I told you he has the abductor splint and the TED hose, and his toes have been warm and pink, so I think we're good there. IV fluids. In this arm, in his right arm, he has NS running. It's an 18 gauge, so you can use that for blood. In the other arm, he's got the PCA pump in his left hand. And on that one, he's a pretty hard stick, so please save on to one of them. You're probably going to need them. He has cardiac history, coronary artery disease, and he's on several medications. He is in atrial fib and gets diltiazem for that. Seems to control it fairly well. He's on atorvastatin and lisinopril. He's also diabetic, currently on a sliding scale with a correction factor of 1 to 30, and had been on metformin prior to surgery. So, in terms of his clotting factors, he was on Coumadin prior to surgery. That's currently on hold. His INR was 1.8, so pharmacy can probably help with transition and get that started again. He also has GERD and is on Prilosec for that. We have several PRN orders, one for Ambien, one for Zofran, and he is also on, the Zofran is regular IV antibiotic, and Senna for constipation. His activity level, he was up last night with physical therapy, seemed to tolerate that well. So I think that he should be on the road to recovery here. Diet is tolerated. It is a cardiac diabetic diet. And I think I said that we have the neurochecks Q4 and things were fine. Social history, this is where my concern is for this gentleman. He has a history of smoking, but says that he quit about 10 years ago. No evidence that that's not true. He does self-report that he drinks 2 to 4 beers a day. I think that's understated. He started getting really agitated during the night. I called and got an order for some Ativan, gave that around 4, and he seemed to settle down quite a lot. So you may want to do an assessment for alcohol withdrawal. I think that may be where we're headed with him. He has 2 children, and one lives here, and she was here last night. A daughter was here last night, and does report that she thinks he drinks more than what he's reported. So you'll probably want to follow up with that. Okay, any questions? I did forget to tell you, he does have a Foley that can probably come out today. His output was about 800 during the night shift, and so I think he's moving along pretty well if we can make sure that he's not got any other things going on. So, okay, thanks.